Dr. Jason, and end of the day, it's 4:30, and came back to my desk after work, and our implant rep, Scott, left this cool little box on my desk, and I thought I'd share it with you. So we're blessed to do a ton of implant dentistry here. It's become the standard of care for replacing missing teeth, for helping dentures stay in better, for replacing all of someone's teeth. But everyone's always asking me, like, all these parts, all these screwdrivers, stuff like that, like, how does it really work? So thank you, Scott, for giving me these little toys. I'm going to show you real quick. So this is what the actual implant, it doesn't really look like this, but it's a titanium screw, a post. I've heard different people call it different things. This is what gets threaded into the gum and bone. So what happens more often than not is we take the tooth out, okay? And then this gets strategically threaded into the gum and bone. And then the gums, most of the time, heal over it, so you can't see it, okay? So again, it's kind of like a screw. And the quality of your bone really dictates if we can leave this screw exposed and stuff like that. I always tell patients that use the analogy of wood. So if you have wood that's like oak, then the implant will go in really tight. If you have bone that's like pine or balsa wood, it's going to go in soft, and that'll kind of lead to different healing times and stuff like that. Anyways, so the implant is right here, and then you have what's called an abutment. And the abutment is basically the connector between the implant and the crown, which I'll show you here in a second. So once the implant heals and it's ready to be used, this abutment gets threaded right over the top, okay? And again, remember, you're not going to see the implant because it's buried under the gum and bone. So the abutment gets put over the top, and then this crazy screwdriver goes in here, and it's literally screwed into place. And those of you out there that have had implants placed, you know that we then take the torque wrench. It's literally a torque wrench, and everyone always makes the jokes. What am I, a used car? Like, what do you... But we literally have to torque this down to a certain value. Otherwise, this abutment will get loose. So once the implant is placed, and after, sometimes right away, sometimes immediately, sometimes it takes 3 to 4 months, depending if there was bone grafting done and stuff like that. Once the implant abutment gets screwed on and torqued, then the custom crown, made right up the road in Canandaigua, New York, by the wonderful Audrey and her crew at Artisan Dental Laboratories. The crown gets either screwed in or cemented right over the top of this abutment. So again, if you're playing along with me, and the implant is under the gum and bone, the abutment is under the gum, so you can't see it, and then the crown gets put right over the top of it. So implant, abutment, crown. That's your 2-minute tutorial on implant dentistry. If you have any questions about if you're a candidate for implants or how different people are using implants, let me know. It's becoming so mainstream in dentistry. We're blessed to do so much implant dentistry. I love helping patients utilize implants to keep in dentures. It's just been life-changing, when, especially lower dentures, when you can place 2 or 4 implants and then hook them up to a denture. Patient can start to chew again. They don't worry about it rocking around. And even lately, we've been doing a ton of upper dentures with implants, because even though the denture stays in pretty well, patients get frustrated because the whole roof of their mouth is covered with acrylic, and they can't taste things. Hot things aren't hot, cold things aren't cold. So if you have implants holding in the upper denture as opposed to suction, you can remove all of the acrylic covering the roof of your mouth, and it's just like, I can taste things again. So that's it. Reach out if you have any questions. Thanks for watching.